Hello, this is Dr. Feast Price, and I'd like to expand your knowledge base regarding assessing client problems by focusing specifically on the clinical interview or assessment. There are multiple ways of identifying the presenting problems of a client with mental illness. One of the ways in which we identify the problems might be from observations. And so those, when you have qualified mental health professionals that observe the behaviors of a person with a mental illness, and based upon their observations, they're taking notes, and then they look at the notes as per the behaviors, and they identify various kinds of mental illnesses that the person may be presenting with as per their observations, and then they compare the notes, sometimes across professionals or within the individual professional, to determine the mental illness that a person might have. Another way a mental illness problem may be assessed is through quantitative means. So you might have different kinds of tests, from the MMPI to the Rorschach to various kinds of assessment tools that help you to best understand some of the mental health issues that the person is presenting with. The specific kind of way of assessing a problem that I'd like to spend a little bit of time talking about is the clinical interview or assessment. And so in this brief lecture that I will provide, I'd like to speak with you about understanding the importance and relevance of the clinical interview, as well as talk with you about some of the components of the clinical interview or assessment. And the reason I say interview or assessment is because sometimes clinicians identify it as a clinical assessment, particularly among psychologists, they'll call it a clinical assessment. And sometimes it's referred to as a clinical interview. And so whether you use clinical interview or clinical assessment, basically we're speaking of the same assessment tool that's used to assess the extent to which a person has a particular mental health problem. So with regard to the clinical interview or assessment, number one, the first thing you should know is that it's one of the ways by which clinicians obtain relevant information regarding a person's mental health. I talked about clinical observations. I mentioned some of the objective ways in which persons determine mental illnesses, which oftentimes it might include the MMPI or other kinds of personality inventories. It also allows the clinician to obtain a holistic picture of the client as well as their presenting problem, not only as it relates to the present time, but historical issues as well. Because we know as clinicians that sometimes the problems that are manifested in a client is directly related to some of the problems that may have occurred in the past. We also recognize that the clinical interview or assessment provides information on the most salient issues that must be addressed in best understanding the client. And so what I'd like to do with this next slide is just talk about some of the core areas that are most important in the clinical interview or assessment. So whenever you meet a client for the first time, you always want to ask, first and foremost, what is the presenting problem or problems? And so this question allows the client to discuss various kinds of issues that are bringing them to therapy. It might be marital, it might be the loss of a job, it might be substance abuse problems, but there are both primary and secondary issues that are the presenting problem. So like, for example, thinking about a client that I met with recently, the presenting problem was substance abuse. But in addition to substance abuse, there were also some familiar kinds of problems, marital discord, that contributed to the problem. So while one of the primary problems might be substance abuse, secondary problems may include marital discord, unemployment issues, self-esteem or self-worth kinds of issues. So it's really your opportunity as the clinician to understand what the presenting problems are, and that gives you some insight as to how you will focus your treatment in working with a person with a mental illness. The next item that I have on my list is social support network. And please know that this information may not necessarily be presented in this order. However, it gives you a frame of reference by which to understand the client and the core areas that you want to assess when meeting with the client. So it's always important to identify social supports, who are the persons within their social network. It might be family members, it might be a significant other, it might be a religious organization, but any areas whereby the person finds support and it allows them to withstand whatever the adversities are that they might be experiencing. Another area of importance is education and vocational kinds of issues. With educational issues, we know that some of the problems that people exist may be related to the extent to which they have a high school education, skills, training, as well as higher degrees of higher learning. It not only impacts their ability to obtain employment, it also has a lot to do with self-esteem, self-worth, position in life, the ways in which they see the world. And so you always want to get a feel for some of the educational as well as vocational kinds of issues. We know that one's vocation is more than simply the job where they're working in. Our vocation also helps to identify us, and it connects us with other individuals. So educational and vocational issues are also very important to understanding the clients with whom we work and when we are conducting the clinical assessment. You want to also understand medical history. Are there any medical issues, any surgeries, any kind of physiological kinds of issues that might limit one's ability? And so you want to take those issues into consideration as well. Along with the medical history, one's mental history is a part of that. So in terms of medical history, it's looking at physiological kinds of issues as well as mental issues. So you're wanting to understand the extent to which there are both physical as well as mental kinds of issues that exist within the person. Family history is very important. We know from family therapy, particularly as people talk about the genogram, it gives you insight on some of the generational kinds of issues that persons present with in a therapeutic context. It helps you to understand the individual, and sometimes, while you may not use this information to intervene with the client or to treat the client, it does give you that holistic information by which to understand the client. Another issue has to do with abuse, various kinds of abuse that the person may have experienced that might impact the lenses through which they see the world. So oftentimes even doctors, medical professionals fail to ask whether or not a person has ever experienced any kind of sexual abuse. And so you always want to determine whether or not there are issues of sexual, physical, or emotional abuse, because we know not only from what's in the literature, but in working with persons, the extent to which there has been a history of abuse, it will impact the way in which they see the world. It impacts issues of trust and interactions. And so while that may not be the presenting problem, it does contribute to the gestalt. And that's what we're aiming for, is understanding the client in his or her entirety. Additional areas that you might want to inquire about is a typical day. I always ask the client to tell me what a typical day is like. How do you spend your day? On most weekends, what does that consist of? Again, that gives you information specific to their social network, meaningful relationships and interactions. So, as it relates to the social support network, pay particular attention to the typical day and how they spend their days and how they spend their weekends and what do they do for fun and pastime. Another important area that I find to be really important is um, run-ins with the law. So whether there have been any legal convictions, if they've ever been to prison or jail. And while these kinds of questions may be extraneous in working with some clients, there are instances where when you are working with maybe people with substance abuse histories or people that have had experiences in correctional settings, you want to understand their criminal history, the kinds of stints they've had in the correctional setting, and their ways and any kinds of treatment that they have experienced. So whenever you work with clients, these are the myriad components that you must take into consideration when working with clients, meeting with them, interviewing them, and conducting a clinical interview or assessment. There are instances where other information may rise to the top when you're working with your client, especially if you have good rapport. And so you do want to pay attention to those that information as well. But at its core, these are the specific areas of significance that you must pay attention to when working with conducting the clinical interview or assessment. So basically, that's it in a nutshell as it relates to this brief overview of the clinical interview and assessment, which really complements the information that you have learned in the in your previous lectures that relates to the initial intake interview. So I hope you find this information helpful, and as you work with any case studies, or working with persons with mental illness, please pay particular attention to the relevance of these key components. So thank you for your attention, and I hope that you find this information helpful.